when we gave them the tocotrienol, it seemed to salvage the body's own mechanistic protein that are antioxidant.
Welcome, everybody. This is Buck Joffrey here with the Longevity Roadmap. And today we're going to talk about something interesting, something that I didn't know very much about, which was vitamin E. And, these kinds of shows are really useful to me because it just seems like, when it comes to creating the supplement stack that people have, it's useful to know what these things actually do. And in some cases, like you'll realize from listening to today's show, there are some things that people are taking that might actually be not only not good for them, but potentially bad for them. And so that's what we're going to talk about today. We're going to talk about vitamin E with Dr. Barrie Tan, who's an expert in this space. But notably, not all vitamin E is created equally. There's a couple of different forms of it, as you will learn, tocopherols and tocotrienols. And the tocopherols are actually bad for you, but it seems to be the kind of vitamin E most commonly available in supplements. So that alone, I think, is significant value in this. There is a lot of biochemistry in this show. Barrie is a biochemist, and so he does get into some of that stuff if you like to nerd out on it or not. But even if you don't, you can kind of, listen in, and the big points are pretty clear. Now, based on this, you may or may not decide that adding something like this to your regimen might be useful. To me, the most curious part, or the potentially useful part of this, may be its role in metabolic syndrome and fatty liver. So anyway, really interesting conversation. Make sure to tune in, and we'll have that interview right after these messages.
Hey, longevity enthusiasts, it's time to take it to the next level. I've been fine-tuning my longevity regimen for years, and I look better and feel better than I did a decade ago. In fact, my blood work is even better than it was back then. And it's all because of my data-driven regimen. And it's inspired me to create a course and community just for you. It's called the Longevity Roadmap, and I urge you to check it out. If you're tired of your belly fat, tired of being tired, or just want to optimize yourself for the next 50 years, visit longevityroadmap.com. That's longevityroadmap.com.
Welcome back to the show, everyone. Today, my guest on Longevity Roadmap is Dr. Barrie Tan. He's a PhD in chemistry and one of the pioneering researchers in the science of tocotrienols, which are a potent and lesser-known form of vitamin E. He's credited with discovering tocotrienols in the annatto plant, and he founded American River Nutrition, where he developed Delta Gold, the first tocopherol-free tocotrienol. That's a mouthful, by the way, supplement. With over 30 years of research and numerous peer-reviewed publications, Dr. Tan has helped reshape our understanding of vitamin E, its potential in chronic disease prevention and healthy aging. Welcome, Dr. Tan. How are you?
Thank you. Nice to meet you, and look forward to our interview this afternoon.
Well, let's start with the basics, Barrie. The role of vitamin E, as you know, in the longevity space, there are so many supplements and so many things that people are doing now. What exactly is vitamin E? Remind us on its role it's played in human health, and why it's important.
I see. Vitamin E originally was the compound called alpha tocopherol. It is known as a vitamin because of the specific role. Probably people know it as antioxidant, but that does not make it as a vitamin. It's known as a vitamin because alpha tocopherol is required to bring the fetus to full term. So it's actually a birth vitamin, and it was discovered by two medical doctors, pediatrician at UC Berkeley, 1922. So it's a little bit more than 100 years ago. And so in the evolution of time with its discovery, then came other vitamin E molecules at that time was not known, gamma, delta, tocopherol. That came mostly in the 1930s, and then some time lapsed in the 1960s. Then they found another group of compound very similar to the tocopherol, except that it had 3 double bonds on the tail, and hence the word triene, 3 double bonds in the tail, trienol. But otherwise, they're analogous to tocopherol. So with its discovery in the 60s, people didn't do much about it other than to say they're probably antioxidant and the plant makes it until you then fast forward another 20 years or so. University of Wisconsin medicine professor Asaf Qureshi of Pakistani extract, and then he discovered that the tocotrienol, these unusual kinds of vitamin E, have differentiated properties from tocopherol. So that was the early 1980s. And then I started my career at the University of Massachusetts here, studying palm oil, and I discovered comparable compound in palm oil. So that started my career to study this vitamin E. And even that is a little bit more than 40 years ago. So that's a little snapshot background about vitamin E.
But if you talk about it in terms of basic health, right? I mean, when we, we've actually interviewed experts on vitamin D, and the role of vitamin D, in many ways is it's almost like a hormone. But outside of antioxidant role, you mentioned that there was other roles. What else do we know that the vitamin E is involved with?
Yeah. Now, you mentioned vitamin D, which is interesting. Vitamin D would kind of work like a hormone because it's in the microgram. But for vitamin E to work is in the milligram and oftentimes in the hundreds of milligram. So 1,000 orders of magnitude different. So it doesn't work in a hormonal sense like that. So what other functions? The other functions of vitamin E would be on chronic conditions. So I want to describe that. However, I want to tell about the bad news. In the 1990s, there were a lot of ammunition put on alpha tocopherol on studying chronic condition. Most of those published studies turned negative. So I wanted to disclose that. I didn't want to hide that. The alpha tocopherol did not show up. So at best, it did not work. At worst, it may even do harm on prostate cancer and breast cancer. You can Google. Most of the studies were done in the Boston area from Harvard, large-scale clinical study. They largely fail.
Before you do that, I think it's important. What we're talking about is the two main types of vitamin D E. Just so people know, there's, as I understand, they're basically tocopherols and tocotrienols, right? And so what you're pointing out is some of the studies that were done on tocopherols.
Yes, I'm talking about tocopherol. Now, I know most people don't do this. I'm a chemist, so this is the molecule of tocopherol, and that's an OH group here, which is a phenolic. If I blocked it, you can see the phenolic. So if you take away the phenolic side, the tail, see that? And I have to hold it like that. You see, there's a double bond 1, 2, and 3. Were this to be a tocopherol, the hydrocarbon chain here would be saturated. And tocotrienol has got the 3 double bond. That's it. Apart from that, the tocopherol and the tocotrienol would be analogous. It is this molecule, the tocotrienol, makes all the difference. And that difference was brought about by Dr. Qureshi in the 1980s. He saw that the tocotrienol have differentiated properties than tocopherol. And then I wrote a textbook with other people. If you just see the title here, tocotrienol, vitamin E beyond tocopherol is the 2012 textbook. And then many authors wrote in and talk about the differentiated properties. So then that's the background. Your main question is, what would be the role? So if the listener would be medical doctors, I would expect to want to know that. Over the last 20, 30 years, I've systematically first done animal study and then clinical trials. So I'll just jump straight to the clinical trial. Of the clinical trials that we have tested on chronic conditions were dyslipidemia, metabolic syndrome, prediabetes, diabetes, NAFLD, fatty liver, and also in a stage 4 cancer patient. So those are clearly chronic conditions. So you can pick any of them, and then I can discuss what I know about them in a brief hour that we have,
Well, let me ask you this. You mentioned briefly before I interrupted you that there was some studies showing tocopherols actually showing some potentially negative impacts.
Yes, because we did not know this but when we first did the work. Initially, we found tocotrienol to be abundant in palm oil. Most people know palm oil because of the saturated fat, and then avoided that. And then we found out the tocotrienol. So typically in palm oil, you have about 25% tocopherol or more, and then about 75% tocotrienol. That's how the tree makes it like that. So when we were doing study with this palm oil, we thought that the alpha tocopherol maybe work as an antioxidant, but is innocuous like that. So we were clearly studying the tocotrienol. So we did not pay attention to standardizing the palm tocotrienol. And then when we did about 5 clinical studies, about 2 of them work and 2 of them do not work, and 1 of them kind of work, kind of not. So it's the worst statistical art, which is half work, half not work. So it really bothered us because in animal study, we didn't see that. And then Dr. Qureshi did the study. He found out that when the alpha tocopherol of the total vitamin E is about 20% or less, they seem to work. When the alpha tocopherol composition of the whole vitamin E is about above 20%, and then it gets worse at 25 and really bad at 30%, it didn't work. So he gave him the idea that, the tocopherol may be antagonizing the function of tocotrienol. So he just stopped all the clinical study, which is a very painful thing to do. And then he went on to do animal study where he gave a fixed amount of tocotrienol in the study with no tocopherol, and in each of the 4 study, fixed amount of tocotrienol. And then he add on 0, a little bit more, a little bit more, a little bit more. And then in the middle, but the third one, so no tocopherol, yes tocopherol, the function to lower cholesterol drop less. And then when you add more tocopherol, it dropped even less. And then a little bit more tocopherol, it completely does not even lower cholesterol when the tocotrienol amount is the same. So he established the fact of the interference of tocotrienol function by tocopherol. So therefore, at the end, when we did study, we make sure that there are no tocopherol. So where I came into this, where I actually stopped because I was so despondent by that. And then I went to South America, and this story, I hope your audience may not mind this. I went to South America in my little vitamin E book here that you can download for free. I look for, encouraged by ophthalmologists, I look for lutein and zeaxanthin in marigold flower in Peru. That was what I went to look for. And then fate has it, literally 30 feet away from me, I found the annatto plant that looked like this. If you think of this annatto plant, I purposely do this, then you can see it will stain the hand. We use the annatto color for cheese making, Dorito chips, stuff like that. And that carotene is conjugated double bond, which means that they are very unstable. Compared to even compared to all fish oil, they're highly unstable. But most carotene in plant sources, they're in the cytoplasm, like beta carotene in carrot, like lycopene in tomato, even astaxanthin in lobster, like that. So the astaxanthin would be a very clear example. You cook the crustacean, and then the yucky green-blue color become orange when you deprotonate it. So, however, with this annatto plant, it was not like that. It literally stains your hand. So I surmise that there must be a powerful antioxidant that prevent the oxidation, and so that the keratin does not go bad. I was believing it to be a polyphenol, and then I found out that it was the tocotrienol that protected. So that set me the path to analyze it. And when I analyzed the tocotrienol, it was the only time of the hundreds of different species that I have looked at that this tocotrienol is the most potent source and is free of tocopherol. I immediately called Dr. Qureshi. I found a source of tocotrienol without tocopherol. That means I don't have this interference problem. And I remember exactly what he said. He said, Barry, if tocotrienol is supposed to mitigate all these chronic conditions, you got it. If it didn't, you and I are the two scientists most pitiful because we have spent decades to study this. So that was in the year approximately 1999, 2000. And I stayed, and all the clinical study were done using annatto tocotrienol because it's free of tocopherol.
Before we get into that, so, just, it's interesting because one of the things I noticed when I was reading up on this was that most vitamin E supplements are still made of tocopherols. And from what you've told us, that is not only that is only not necessarily beneficial, but potentially harmful. Is that right? So why is the medical community or whoever does the standards on these supplements not paying any attention to that?
I don't really know. I think tocopherol was made and sold in the marketplace for so long. And if you look at the published clinical study or animal study on alpha tocopherol, it's massive. Nothing really came out of it. It's just nothing really came out of it.
Is it even an antioxidant?
Antioxidant, yes, it does have antioxidant property like that. So even the antioxidant property, if you look at the study, the antioxidant tocopherol that is most potent is gamma, like in gamma X-ray, a gamma ray, gamma tocopherol most potent, and not alpha tocopherol. If you look at the plant vegetable oil, like soya oil, which is our vegetable oil, about 3/4 or 2/3 of the vitamin E that it produces to protect its fats from oxidation in soybean is gamma tocopherol. The reason I believe people try to use alpha tocopherol and converts everything of vitamin E to alpha tocopherol is for the reason, and the reason is now archaic. The reason being they convert all the milligrams of alpha tocopherol, all the tocopherol to alpha tocopherol because per milligram alpha tocopherol have the highest international unit. So therefore, if you have 10 milligram, you have 10 IU, simplistically, for alpha tocopherol. If it's gamma tocopherol, for example, 10 milligram has 1 IU. So therefore, there's not IU claim. But but the whole thing is a farce because the IU has to do with bringing the fetus to full term. The whole thing is so stupefied. It was purely a marketing thing.
So it's basically to sell something that's easier to sell. You can get more of it. It's probably cheaper, that kind of thing, right?
Yes, yeah.
Okay, well, let's move back to the tocotrienols then, which you're focused on. Let's talk about metabolism and longevity. What role, you mentioned some, and maybe you can go into some specific studies in terms of reversal or prevention of conditions like metabolic syndrome or insulin resistance.
Yeah, we first started to do the study because we noticed that generally the LDL and the triglyceride drop in healthy adults, but we didn't know the mechanism at the time, and so we did on people with hypercholesterolemia. We did not find that it worked on people with genetic hypercholesterolemia, but with cholesterolemia they did, and the drop is about half as good as a statin drug would. So statin drug typically 40-50% drop in cholesterol, then you might expect 15-20% drop. So it's nothing to sneeze at, but it's not bad. So if someone have moderate, okay, like 150, 200 cholesterol, if it drop about 15-20%, not bad. And the amount taken is about 150-200 milligram, as opposed to plant sterol, you may have to take a gram or two. So it's very deliverable like that. I noticed that when I got into the foray to do the study, I consistently saw the triglyceride drop. Now, I know triglyceride is also a marker for heart disease, but I was particularly interested in triglyceride with a different slant. You notice that when people with metabolic syndrome, their cholesterol is not necessarily high. The triglyceride is kind of high, but not hypertriglyceridemia. And then the sugar is high, but not high enough to be diabetes like that. Blood pressure got up a little bit high, waistline, like the metabolic syndrome
Yeah.
type thing.
Yeah.
And then when I saw that I noticed that the triglyceride drop is even a little bit more remarkable, usually 10 or 20% point better, meaning if the cholesterol drop by about 15%, I oftentimes see the triglyceride drop about 20, 25%. I say, okay, if the triglyceride drop that, then these may have better implication of triglyceride in the liver and also in metabolic syndrome. So we did metabolic syndrome and we saw that the metabolism in the body is so out of kilter, and then it came back to kilter on a metabolic syndrome. So encouraged by that, so we did. Typically, the triglyceride drop about 15-20%. So an endocrinologist may take blood work, the transaminase, ASLT, ASPT, the liver enzyme, they all drop. C-reactive protein drop. And then before I gave up the ghost on studying clinical work on tocotrienol, I decided to take my big challenge of my life at the time. It was a 5-6 year study where I decided to look specifically on fatty liver disease. And in that, the AST, ALT dropped initially, and the C-reactive protein dropped, the triglyceride dropped. So I know the blood chemistry works good.
What kind of studies were these, Barry? Were they randomized clinical trials?
They are randomized, double-blind study, not large, about 120 patient, placebo control. So we gave them about 300 milligram tocotrienol twice a day. They clearly is ultrasound confirmed or NAFLD confirmed that they are fatty liver patient like that. So, but they are not NASH yet, just NAFLD. NASH will be probably on a list of transplantation. They're not quite at that stage. So we did a 3-month study, finished and published that. And then a 6-month study, we did that because we weren't sure if the work is also a time dependent. We know the dose dependent 600 milligrams. So we did the 6-month study, and then we make more marker like HOMA IR that endocrinologists want to measure, where you measure that the sugar would drop, but the insulin resistance also decrease and the insulin sensitivity increase, and together is a measurement of both. The sugar dropped and the insulin sensitivity increase. So we did that on the 6-month study. So finally, I decided to do a 12-month study, and we consistently saw that, and we did CAT scan, and we saw that the fatty tissue, the steatosis, also egress from the liver. So I'm pretty confident in that. And we have a surprising side finding, which I did not cater for in the original study. We saw that the patient consistently lost weight in the 3, 6, and 12 months. Like that, the weight loss is about 10-15 pounds, not dramatic. Now encouraged by that, so we're gonna do this. Help me out. What is this study that the weight loss product? What are they studying?
The GLP.
At the time we saw the weight loss, but we didn't measure the GLP. The very last study we are doing now is on people with obesity. So we are going to study the GLP to see if there's any implication there. Mostly until then, the tocotrienol reduces severe inflammation, the pharmacologic inflammation on the people, and with the adjustment of the reduction of inflammation, the weight loss adjusted. At least that's my working principle.
So your principle, your theory here is that all of the benefits that you're seeing are related to decreases in systemic inflammation?
Yes, this is because we consistently see interleukin-6, C-reactive protein, and some biological marker, not
high sensitivity CRP.
High density CRP. Yes, always high. And we must have done about 3 to 5 clinical study where the HSCRP drop like that. And those are clinical markers. And the non-clinical markers that not quite got into clinical thing, like interleukin-6, tumor necrosis factor, they all seem to be dropping. So it just seemed to me that the control of the inflammation matters to them. We also see oxidized fat. We also measure oxidized fat. That's not a clinical marker, it's more a scientific marker. So clearly it acts as a strong antioxidant as well.
It's a lot of different outcomes simply from decreasing inflammation. Obviously decreasing inflammation can have profound benefits. It also seems like there was likely something else going on with this. I mean, especially if you're, decreasing lipids. Did you also look at apolipoprotein B levels?
Not in earlier days we did, but not more recently. We didn't do that.
Okay.
So what we have established so far is that it mitigate the obvious chronic markers that can be clinically measured, but the other specific markers are different ones that we have tried, and oftentimes we would be able to net a few, but not all the different markers. So anyhow, that would be. We also, but we also measure. Scientists oftentimes do that. We have biological and natural antioxidant in our body, like superoxide dismutase, glutathione peroxidase. These are antioxidant protein, or even glutathione. We consistently see these kind of markers go up. So therefore, when we gave them the tocotrienol, it seemed to salvage the body's own mechanistic protein that are antioxidant.
So the dosing that you've done in the double in the clinical trials, but you said 300
2 times a day.
300 milligrams, is that?
300 milligram of the
twice a day. And the question I have is, one of the things that my listeners are doing is often they have regimens of supplements. And I guess one of the questions is, where does this fit in? Is there synergy between, the tocotrienols and omega-3s, NAD precursors, polyphenols? Is there anything we should be worried about? Side effects? Just curious in terms of the practical part of this.
Yeah. I have not seen the tocotrienol have adverse effects with other supplement, but we have seen positive effect synergistically. So we have done study with tocotrienol and resveratrol, and then even with quercetin, and we found that tocotrienol works well with resveratrol like that. And we tried also with EGCG, we didn't find. I'm not saying that the other supplements are no good. It's just that when we add with them, the one that we find most synergistic is tocotrienol with resveratrol. We found that to be good, like that. And
what did you find in that? I mean, with resveratrol itself, there's just so much data that there's not a whole lot that resveratrol actually does, despite David Sinclair's comments on that.
Yeah, we found that in the tocotrienol with resveratrol, we measure the waistline. These are metabolic syndrome people. The waistline, so the central waistline decrease. So that's a good sign for people with metabolic syndrome. Particularly, they have more like apple shape rather than pear shape. So we saw that, and when we did that study, we saw that they work with young adults. In the normal tocotrienol study, we work with older adult, meaning 55 years to 65 years. But in the resveratrol tocotrienol study, their average age is about 40, 45. So the young adults, and it work, including their weight loss, not a lot, but weight loss, as well as C-reactive protein drop. So I think when we did that, we kind of stopped, because if you look at the structure of resveratrol, it's kind of like an example of a polyphenol. There are many, many polyphenol, so I have to choose what to study. And since it's easily accessible, it's somewhat well known, is known for not preventing the shortening of the telomere and all this. We didn't do that study. We simply just do this, and we saw that. And we did it with quercetin. We didn't quite see that. However, with quercetin, as we would have done that, the doctor that did it also checked with some drug. And since we are not hearkening to the drug route, so we didn't. We also did another study where we gave tocotrienol and CoQ10. That study was done probably with people that took statin drugs, because they need to supplement the CoQ10 to increase the amount of CoQ10 that statin decrease. So we did that. And we did that because tocotrienol already riding on a cardiovascular platform. So when we did that, we saw we could titrate down. This study was done quite a long time ago, when the first generation of statin was lovastatin, Mevacor, and now we have many, many generations after that, and we can titrate half the amount of Mevacor, lovastatin, and add tocotrienol, and it would be comparable at the time. But we didn't do it as the next generation, second and third generation like that. That study, maybe another time you can interview me on this. If you look at the pathway where statin inhibits, and the physician would be very interested to find that, and that is, you think of it as Interstate 95, the most traffic highway, and you use the statin zap at Boston, and then at the New York City, it segue the cholesterol drop intended, and usually that's the Truman Show. There's a blank wall there, and that drop, everybody happy. But if you take away the Truman Show, the segue is at 15 carbon, and the inhibition by statin is 5 carbon. The body makes 5 carbons at a time, 5, 15, and the 15 is called farnesol. And then at 20 carbon is called geranyl, GG, geranyl. And that segue, people never went down it, is that GG that segue to make CoQ10. And then that segue also make MK4, menaquinone 4, and that segue make a skeletal muscle protein. So if you lift the Truman blanket away, then you see that the reason statin lower CoQ10 is because it inhibits GG, and GG is required for the synthesis of CoQ10 as well as MK4, and MK4 is important for taking the calcium to the bone. So there's some study that show that if you take statin drug, you actually have calcification of the artery, because you inhibit the MK4, is supposed to take the calcium to the bone, and the calcium is littering on the artery with the angstrom unit going up. And the other one physician cared the most about, if you take statin drug, would the patient have myopathy? And the reason patient have myopathy is because GG is required for the synthesis of skeletal muscle protein. Interview me sometime on that. I got rich information on that, you know. So I know it's not tocotrienol. So this tocotrienol is what I said to you earlier. It's a good cardiovascular platform with CoQ10.
Yeah. Any contraindications for using tocotrienols?
To the best of my knowledge, now none. A physician, he's a GI tract surgeon in Florida, and he was giving tocotrienol to people who have cancer. That's a piece that I didn't talk about unless you want. If you don't, I tell you how he addressed it. He had to surgically remove the pancreatic cancer, the deadliest of all cancer. If you think of how they cut it and then lift up the different organs until you get to the smaller pancreas like that, the liver and the stomach like that. So he wanted to show, when he dosed people with tocotrienol before the surgery, would it cause bleeding and the failure of this post-surgery for the wound to heal? And he found out that the tocotrienol did not prolong clotting, and the healing is no different than the ones that were not taking tocotrienol. So that would be the closest people test, because there's always that possible understanding that taking vitamin E would mess up the vitamin K system that causes the clotting when clotting is needed.
Right. So your product, it's Delta Gold. Is that right?
Yes.
Where can people get Delta Gold?
Oh, I would say the most trusted brand that I know is a physician verified, is from Designs for Health. DESINGS. Let me show you a bottle here. It's an empty bottle. It would have that logo.
Sure.
Designs for Health, like that.
Yeah.
They physician and naturopathic doctors.
Those are on Amazon, right? I've seen
on
that
Amazon,
brand before.
and I think that they call it annatto E. They simply just call it annatto E. And so I would say for a person taking it as an antioxidant protection, we have so much phospholipid in a cell wall like that. 150 milligram 2 times a day would be good. If a person has mild chronic condition, probably a 300 milligram once or twice. If they're metabolic syndrome, we gave people 600 milligram to 300 milligram. And then people who have cancer, we have done 4 clinical studies with promising data on ovarian cancer and on colon cancer and on pancreatic cancer. And data still not yet come forth. Is a lung cancer and a colon cancer study not yet finished. So, and in those studies, people take 900 milligram, meaning 300 milligram each, TID, for breakfast, lunch, dinner. When you take the supplement, because it's oil soluble, please take it with a meal, not on an empty stomach.
Okay. If people want to learn more about what you're doing, Barrie, where can they find more information?
2 ways. If you simply type my name, Barrie Tan, Tan is easy. Barrie is spelled Barrie, Barrie Tan. Or if you go to American River Nutrition, if you just simply type American River Nutrition, then you'll be able to find me. But mostly if you type my name, it just goes straight there. And then you can download all the papers we publish like that. So
thank you so much for your time today, Barrie. It's been a very useful conversation.
Yeah, thank you, Buck. Appreciate the opportunity. Hopefully, the physician will learn much from this conversation we have. Thank you much.
Thanks for listening. A quick reminder that while I am, in fact, a surgeon, nothing I say should be construed as medical advice. Now, make sure to include your physician in any medical decisions you make. And also, if you're enjoying the show, please make sure to show your support with a like, share, or subscribe.